I thank the organizers for giving me the opportunity to talk on this innovative topic, virtual reality planning to promote safety and reduce complications during minimal access surgery. So the only thing permanent is change. So virtual reality is something which helps the surgeon plan surgery by giving a prior idea of anatomical relationships in a spatial plane. So the immersive view has a clear advantage in 3D visualization. So here in this lecture, we will see more about these virtual reality applications. It's a computer environment with the scenes and objects that appear real, making the user feel that they are immersed in the surroundings. So it needs a VR headset. So you might have seen the little children playing with a virtual reality headset. So they feel that they are in the space. They are able to capture Neptune, Uranus, everything, and they are able to play around with that. We've been on these rides, virtual rides, where we can surf through the water or surf through a roller coaster. Normally, we might be afraid, but here again, the same fear is reproduced without being in the risky environment. Now, augmented reality is something which augments your surroundings by adding digital elements to a live view, often by using the camera on a smartphone or an iPad. There is no need for a headset. For example, if you go to a new street in Paris and then take your iPad and then open augmented reality application, you can actually point out what is where based on the image capture. It can also enable a phone to bring pet animals right into your space. My pet dog can be brought into the outpatient department of the hospital, which I normally won't be able to do. So that is an augmented reality. Augmented virtuality is the reverse of it, where in a virtual environment, the real life objects can be visualized. For example, you can yourself visualize deeply immersed in the sea, like that. All right. So the steps of virtual reality is pretty much like the steps of 3D printing, where you acquire the CT scan image. Obviously, it has to be high resolution image with 1 millimeter cuts. Then image the segmentation. Segmentation is a process where you color the area of interest. Then you create the model, then prepare for various augmented reality solutions. So this is a patient where a virtual reality is being tried. This is a patient with a bilateral Wilms tumor, where we have used this virtual reality technology to see where the tumor is in relation to the vascular anatomy, into relation to the normal kidney. We can even use the virtual reality tools to resect some of the tumors and see how deep it is, how much is that area of that clearance margin, etc. We can also look at the volume of the renal, the normal functioning kidney. That's called residual renal volume, how much is remaining after the tumor is removed. So you can actually have an assessment of how good this patient is going to function in terms of renal function. This is the patient who developed the fistula after Hirschsprung's disease pull through, and we could do a contrast study and then figure out how low the fistula is, what direction it is going, and then when we do the surgery, we can actually imagine where it could be. Now, this is a patient who had a horseshoe kidney. This is a volume rendering on the CT scan. This is available in most of the hospitals. But the problem with the volume rendering is it will give the anatomy of the only the portion of that contrast enhanced portion system. So here, using virtual reality, you can actually see the horseshoe kidney. So you can show the parent what is a horseshoe kidney, what exactly is going on there. I mean, they were referred for the severe pain on the right side. But that doesn't seem to be an obstruction because it is just looking like a kidney, which is just the isthmus is causing that deviation, but there is no actual obstruction there. We even did a laparoscopy diagnostic lab to confirm that this is the case. And we just reassured the patient that this is an anatomical issue, not really an obstruction. So this is a 15-year-old girl who is a basketball player. She injured her ectopic kidney. The kidney is actually in the pelvis, and then it ruptured. It had a PUG obstruction. So that was a PUG obstruction of an ectopic pelvic kidney, which ruptured. And this is a volume rendering where, again, it's a poorly functioning kidney. So you could not see where the kidney is. But when you do the virtual reality, they could color the leak of the urine in green, the kidney itself in the brick red color, and the pelvis in the yellow color. You can see the organs like uterus and bladder being colored in deep pink and light pink there. Even the vascular anatomy is there. The nephrologist wanted us to do a nephrectomy because of the poorly functioning thing. But look at the vascular anatomy and then the urinoma. It would have been really complex there. So we decided that whatever function remaining, we will do a pyeloplasty. So what we did was in a supine position with a 10 mm umbilical and 2 5 mm instruments. We went in and then dismembered the pelvis. We didn't even go into that urinoma because that was densely adherent. And then we did a spatulated pyeloplasty laparoscopically for this patient. And the patient is doing absolutely fine after stent removal. And this is another patient, again, another 15-year-old girl who presented with abdomen, but she had a complex swellings. There are two swellings, one on the right side where there is no kidney, but there is an ectopic blind ending ureter on the non-functioning right side kidney side. And there is also an ovarian cyst, which has got a mixed echoes in there. So we were unclear about which one is causing what and what is the relationship of it to various organs. So we can do an overlay of that virtual reconstructed segments on magnetic resonance imaging images here. So the MRI images can also be superimposed on the virtual reality construction here. And we can see that that is nicely being shown there. So these are our various structures which are colored. The uterus is colored in pink, and the bladder is colored in beige color, and the kidney is colored brown. The ovarian cyst is colored green. So multiple structures are there, and then we could even see the bowel behind it. If you want, we can put contrast into the bowel. So we can do this. I mean, this is all being done with immersive touch technology software. So that is the ovarian cyst, which was there, and it was getting repeated torsions. And then there was also this blind ending ectopic ureter, which is dilated, and then like a tubular structure there on the right side of that pelvis behind the bladder. That was also causing problems. So we went ahead and then removed that blind. This is a 3-year-old girl with antenatally diagnosed duplication. She had a recent onset hematuria and evaluated and found to have a calculus in the uretrocele. So this calculus is sitting inside the uretrocele on MR imaging. I mean, you may ask that we know what it is, but we have this access to virtual reality. So we wanted to see how this virtual reality reconstruction is. This is a volume rendering, which we normally do in our radiology suite. But using these images cut sections only, they are doing the segmentation process and they color it to get us that virtual reality. So you can see that the duplication can be seen nicely. The kidneys can be seen nicely. The upper pole is actually functioning very well in this patient. So it is not a non-functioning upper pole. And you can go inside the bladder. It's like a virtual cystoscopy where you can see the uretrocele. You can go behind the bladder. It's much easy to explain to the parent, to the medical student, and ourselves can visualize everything there. So this is indeed helpful for planning whatever. So we went ahead and then opened that uretrocele where the stone was sitting there. So after puncturing it, we could go into that ureter. We saw the stone, and because it was too small, we thought that we should grab it before it flies into the upper calyx. because when you keep irrigating, it sometimes disappears, and then your entire purpose of doing the ureteroscopy is lost. So we grabbed it and removed it. This is a patient with the right upper pole hydronephrosis, and there is a ureterocele there, nicely bulging. It looks a little bit like an ectopic ureterocele. There is no reflux into that ureterocele. On CT scan, this is again the ureterocele being seen. You can do reconstruction. This is a virtual reality reconstruction here, showing very clearly the relationship between the ureterocele and the various things. And here that we punctured the ureterocele with a Bugby electrode and then decompressed the system. So it's pretty useful in a complex anatomy. This is another patient with the left side duplication. Here the upper pole is functioning very well. And the upper pole ectopic ureter is the one which is causing recurrent urinary tract infections. So again, to explain to the parents to understand the relationship between the normal ureter and various structures, it's very useful. You can reduce the transparency of that ureter and see how much it is bulging inside there. So this patient underwent preservation of the kidney. So we didn't do an nephrectomy, but we anastomosed that upper pole ureter to the lower pole pelvis. So it's a ureterophilostomy laparoscopically with a good idea of that anatomy. So how VR can be useful for a surgeon. Immersive view can help. 3D models, it can aid more precision surgery. It can counsel the parents better, and the students can be taught better. So there are multiple real-time applications for virtual reality and augmented reality. So this is the workflow diagram where initially the images is captured, and then slowly the images are being converted into segmentation process where you color that organ of interest, and then you can superimpose it on the various stuff. So the future of augmented reality is like a 2D acquisition, then 3D image and 3D projection, 3D printing, virtual reality, augmented reality, and mixed reality. So mixed reality is where you can actually have the headset. You can also see the patient. So you can see where the tumor is and how deep the tumor is. Both can be done together. So this is probably a mixed reality where they are planning a prostatectomy. So they are seeing the tumor in the spatial plane and then planning the surgery there. So this is from the internet of this particular website. So they are actually planning the extent of resection, and they are wearing this HoloLens where you can see both the virtual image as well as that you can see through it before a robotic prostatectomy. That's what I think they're planning there. So this is pretty useful technology, and the technology is taking us to the next generation. So you can see how they can, this is the way they perceive through that HoloLens. This is the mixed reality. So 3D printing, we have seen the models can provide a tactile feedback, allow for enhanced understanding of the 3D spatial relationship. Virtual reality allows visualization of various volume rendered data set corresponding on 3D image plane. Only thing is that in virtual reality, the user is completely cut off from the real-time environment. Augmented reality is where it permits concurrent visualization of the 3D models in the real-time environment, making it more suitable for the operating tube, the operating room. So technology continues to evolve and contribute to improving surgical safety by reducing the risk of complications, enhancing precision, and enabling better patient outcomes. It is important for healthcare professionals to stay up to date with these advancements to provide the best care possible. Surgeons are well positioned to help integrate artificial intelligence into modern practice. Surgeons should partner with the data scientists to capture data across phases of care and to provide clinical context. Artificial intelligence has the potential to revolutionize the way surgery is taught and practiced with the promise of the highest quality patient care. So the future is here and it is there to stay. We can either choose to embrace it or we can miss the boat. So it's entirely up to us how we deal with the advancement in technology. Thank you very much for the patient listening.